my broad program of research examines the social and structural dimensions impacting 2S LGBTQ people's access to healthcare. And we experience mental and physical health disparities, and it's necessary to be able to access care that's more tailored to fit our needs and meet with care providers who have been adequately educated to meet those needs. Gender-affirming care is not care that coerces trans and non-binary people to medically transition, which I think is a pretty commonly held misconception. And it's also not hormones and surgeries on demand that completely neglects clinician judgment. But what gender-affirming care is it's a psychosocial supports and medical care that encourages health and social care providers to affirm people's gender identities and expressions. And beyond medical treatments for transition, like hormones and surgeries, gender-affirming care may also include better education of providers so that they feel more prepared to affirm trans and non-binary people's gender identities and expressions. In Canada, access to gender-affirming care is really fragmented. And if you live in Ontario, for example, the gender-affirming care services included in our provincial health insurance plan are very different from those provided in the Yukon, where the most comprehensive trans healthcare plan has just been recently introduced. I joined TikTok this past winter term in order to make kind of fun, engaging, teaching-related materials and content for my students. But I pretty quickly learned on the platform that it has really great potential for disseminating knowledge and engaging in dialogue with trans community. It's a great way to get a little bit of early and kind of rapid information or feedback from communities in how's community responding to my ideas and my research. For me, when I see a lot of shares, that gives me some kind of indication that it really resonated and that people in the community are sharing this knowledge amongst themselves.